When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colours. These take the shape of a long round arch, with its path high above, and its two ends apparently beyond the horizon. There is, according to legend, a boiling pot of gold at one end. People look, but no one ever finds it.
Rainbow. The rainbow is a division of white light into many beautiful colours. These take the shape of a long round arch, with its path high above, and its two ends apparently beyond the horizon. There is, according to legend, a boiling pot of gold at one end. People look, but no one ever finds it.
Good morning, and my name is Tabbetha, and this is the third in my series of videos for documenting my transition and also to help other people through their transition. I had to apologise, it's been a while since I last posted. I've been busy moving from the UK to Australia, so this comes from you from Canberra in Australia. And I'll be living here permanently now. Today, I would like to talk about voice and voice surgery and voice feminization. For most trans women, the feminization of the voice is very important. The voice is what people use to identify whether you're male or female. I've had experience of this being misgendered due to my voice. I worked as a nurse in the NHS, and a lot of my male patients I would introduce myself. I'd go, "Good morning, my name's Tabbetha, I'm your nurse for today," and a lot of my male patients would go, "Thank you, lad." I would be wearing a wig, full makeup like I am now. I'd be wearing my nurse's uniform as a dress. And I put it down to they respond to what they hear, not what they see. So a lot of transgender women get misgendered due to their voice. And yeah, it's unfortunate. Trans men, being on testosterone, their voice deepens for most of them. There are some trans men whose voice doesn't deepen. For us, our hormone replacement therapy does not affect our voice. So we have two options. We have the option of speech therapy and learning how to speak in a higher tone, or we have the option of surgery. I went down the option of surgery back in February this year, down at a London clinic, and I've had good results. I did try speech therapy, and yeah, I was able to raise my voice up to a feminine level, but that's the easy part. It's maintaining it at a feminine level when you're having to deal with conversations all the time. When I'm talking to people about voice and why I've had voice surgery, this is how I explain it. When you're in a conversation with someone, you have to listen to the conversation and take the information in. You then have to process it in your brain, come up with a response, and then you have to think when you're delivering that response to raise your voice and speak at a feminine level. And that's a lot to do in a very short space of time. And some people manage to raise their voice naturally and have a feminine voice without the need for surgery. For me, I found it very difficult to achieve and maintain a permanent raised feminine voice through speech therapy. So I opted to go for vocal cord surgery. down in London, and it's been very successful. My male voice was in the region of 100 hertz, very masculine, very deep. My female voice is now in the range of about 200 hertz. So basically, my hertz have doubled in number, raising my pitch to a feminine voice. And these days, it's very, very rare for me to be misgendered. When I went back to work and started talking to the male patients, I didn't get misgendered. They responded to the voice they heard, which is very good. The process of voice surgery was pretty straightforward. I did a self-referral to the London clinic, and I got a response and made an appointment back in November last year. I went down, I had a weekend down in London. I went down and saw the consultant on the Monday morning. He did an examination. On my vocal cords, he stuck a camera up my nose and down to my vocal cords, and he confirmed that my vocal cords were all fine to have surgery on. He did a voice analysis. He got me to read a passage, which it seems to be a standard passage that a lot of voice analysis apps and use. You're talking about rainbows. It gets you to do a passage reading, and then it gets you to just ad lib for about half a minute, just talking about anything which comes into your head. And at the end of the consultation, he said, "Yeah, we can do the surgery," and he offered me several dates. I chose one for February this year, 26th of February it was, and I paid for it all privately. Unfortunately, for vocal cord surgery, the NHS in the UK does not provide any funding, and they will provide funding for speech and language therapy, but not voice surgery. So, as with the rest of my transition, it has been funded privately by myself. February came round, and I went down to London. I took a friend down with me. We had made a weekend of it, or had a couple of days down there. We went down on the Sunday, and I took her out to a show just as a thanks, to say thanks for looking after me while we were in London. And on the Monday morning, she escorted me to the hospital, said bye to me about 8:30 in the morning. I was shown through to a private room. I got into a hospital gown. The consultant came in and had a chat with me just to confirm I was all happy. We did a consent form, and the anaesthetist came in and had a chat with me because it's done under general anaesthetic. And the nurses were lovely. They did your blood pressure and made sure everything was okay. You had to take off all your makeup and all your jewellery, and then about 9:30, I was taken down to theatre. I walked down there. It got me to lie up on the bed. Had a chat with me while they were getting stuff ready, and then last thing I remember before the surgery was them putting a face mask on me to knock me out. About 45 minutes later, I woke up back in my private hospital room with an oxygen mask on, sitting up in bed, and a nurse beside me checking my blood pressure. and yeah, I didn't have any pain. I was pain free through my recovery from the surgery. The surgery, what the actual surgery involves is they do it all through all release, no incisions, no cuts or stitches on the outside showing, and they go in via the mouth down to your vocal cords, and with a laser they take off about 50% of the outer coating of each vocal cord to expose the inner layers of the vocal cords, and then they stitch the vocal cords together. And by stitching the vocal cords together, the vocal cords are shortened. And by shortening the vocal cords, you raise the pitch of the voice. And by raising the pitch of the voice, you get a feminine sounding voice. I've included at the start, before the start of this video, my male voice prior to surgery, and my female voice post-surgery, and this is my relaxed voice. This is the voice I would use when I'm in a relaxed situation. When I'm out and about and meeting new people, I tend to go a bit higher. I tend to go, "Hi, how are you?" And I tend to speak like that all the time when I'm out and about and working. It makes me sound a lot more feminine, I feel. I have to say, post-surgery was very difficult. I couldn't talk for a week, and I'm not very good at charades, so it was really hard on my family and friends to understand what I was wanting or what I was trying to say. So yeah, post-surgery you're not allowed to talk for the first week. After that you can talk for a very short period of time, for 5 or 6 words at a time, and then you had to rest your voice. And then weeks 3 and 4 you can start increasing the length of your sentences and the number of words you use at any one time. After the surgery, I spent a couple of hours in the hospital until they were happy that I was all clear of the anaesthetic. The consultant came in and had a quick chat with me and showed me pictures before and after of my vocal cords, which I still have, and gave me a prescription for antibiotics, anti-inflammatories, and painkillers. I got the prescriptions. I took the antibiotics. I didn't really need the painkillers. I didn't suffer any undue pain or any pain at all. I had 4 weeks off work and slowly started recovering from the surgery. Post-surgery, they encourage you to have a series of speech and language lessons with their recommended speech and language coach. And I found this useful because it taught me how to start using the new voice properly, getting me to use it in the correct way, like lengthening the vowels when talking and raising and lowering the voice. I'm still learning that and still developing that. I find it very difficult, but again, I'm having a female voice now. I'm very happy with the results. Cost-wise, including the pre-surgery consultation, the surgery, and the 2 post-surgery consultations, including accommodation and travel to London for me from Scotland, and the post-procedure speech and language therapy. I think the total cost for me was about £6,500 UK pounds. I feel that's a good investment for a voice where I don't get misgendered anymore. Other people will say, actually, I'd rather just stick and try the speech and language therapy method. And yeah, I agree. If you can manage to raise your voice and maintain it via that method, good. Use the £6,500 for something else, and other surgery. The downside to vocal cord surgery is for people who are good singers and could sing professionally. Following the procedure, you will lose a large amount of range for your singing voice, and the consultant advises people in that situation not to have vocal cord surgery because of the impact on your singing voice. I'm not a singer. I enjoy singing, but you won't want me singing for you. I'm tone deaf, but I still sing away when I'm driving in the car. I enjoy it, but again, it wasn't an issue for me about having a singing voice post surgery. And people have said, I have to say, when I first started talking after the procedure, I sounded very high pitched. I sounded, "Hi, how are you?" A lot of the time, and it's, as I described it, it's how I imagine Barbie would sound when she's talking. But yeah, as I said earlier, I'm very happy with the results. I don't get misgendered anymore. My voice is accepted for a feminine voice, and it's helped with my dysphoria. One of my biggest things was my voice dysphoria. It really affected me, how I felt, getting misgendered on the phone all the time, getting misgendered by my patients. I had to say the female patients were always very accepting of me and never misgendered me. It was always the male patients who misgendered me at work. I don't know, as I said earlier, I think it was just because they were responding to the voice and not what they see. And I did explain this to one elderly man who I was looking after. I was looking after him for a week, and he continuously misgendered me. And I kept on saying, my response was, I prefer lass when they called me dad. And eventually I said to him, "What do you see?" He goes, "I see a woman." I said, "And what do you hear?" He goes, "I hear a man." I said, "Well, why don't you respond to what you see and not necessarily to what you hear? I look like a woman, so treat me as a woman. Don't just treat me on my voice alone, treat me on what you see as well." He kind of took it on board, but he continued misgendering me for the rest of his day with us on the ward. But I hope this explains a bit about my journey with my voice. My male voice was very deep and masculine. My female voice, it still sounds a bit masculine sometimes, but I'm very happy with it. And my wife took. I had to say one of the side effects, one of the impacts it had was on my wife, because she had got used to my male voice between the time we started talking and meeting back in April last year to having my voice surgery 6 days after we got married this year. She found it very difficult to get used to my new voice. It kind of upset her a bit because she had got used to who I was with a male voice, and now she had to get used to me having a female voice. And it's hard. So if you are thinking of voice surgery, make sure you talk it through with your partner, your wife, or husband, or whoever you're close to, and make sure they're on board regarding the changes that they will experience when they hear your new voice. I hope this had helped, and it's been interesting, and hopefully hearing my before and after voice on this at the beginning of this video will help you show the changes that can be achieved. Bye for now. I'll be doing a couple more videos in the near future, and I look forward to you watching them and your comments. Bye bye.